Hi everyone, Dr. Sadaf Krishi this side, and today we are going to talk about anatomical planes. So let's start our topic with introduction. Anatomy is study or structure of human body. So if we have to study the structure of human body, we need to describe the human body, accurate position and movements. And to do this, anatomists use standard reference systems so that the positions and movements are equal and easily understandable, and this reference system is called as anatomical planes. Anatomical planes can be defined as they are imaginary flat surfaces. The first thing is they are imaginary, second they are flat surfaces that divide the body into different sections, and this different section division helps easy find describing location of human body, relationship of human body structure and movement with precision. So the main thing here is to define the human body structure, location and relationship with precision, and for this anatomists use anatomical planes. So to understand anatomical planes are to better correlate with the anatomical planes, we need to have a specific position that is called as anatomical position. This is the human position of human body in which body is straight upright. It is standard position. The first thing, it is standard position. In this position, body is upright, feet are facing forward and together, arms are at outside and palms are forward and thumbs outward. If we see this anatomical position in diagram, we will see that body is standing upright in this diagram. Feet are together and facing forward. Arms are at the side and palms are forwardly placed and thumb is pointing outward. So this is basic anatomical position of the human body. And to anatomical position is important to describe the anatomical planes that were imaginary flat surfaces that divide the body into different sections. Talking about major anatomical plane, there are four important anatomical planes. First is sagittal planes, second is frontal plane, third is transverse plane, and fourth is oblique plane. Now we'll discuss about these planes one by one. So first is sagittal plane. It is vertical plane. It divides the body into left and right portion. So any plane that divides the body into left and right portion is sagittal plane. The types of sagittal plane are mid sagittal plane, when the body is divided in from the mid area or sagittal suture area, it is called as mid sagittal plane. And when body is divided into right and left portions but not from the mid area, it is called as parasagittal plane. If we see in this diagram, if the plane is going from this area, the mid area, we will call it mid sagittal plane. So this plane divides the body into right portion and left portion of body. So this is sagittal plane, and if it is going from the mid area, it is called as mid sagittal plane. But it is going if it is going from the side area and dividing the body into right portion and left portion, we will call this plane as a parasagittal plane. Talking about the next plane, that is frontal plane, it is also called as coronal plane. It divides the body into anterior and posterior portion. So if we look in this diagram, we need another diagram for this. We will consider this is, uh, let me draw the human body. So this is human body. These are the legs. Consider it as, sorry for the diagram, but so if we divide the body into in this way, so the half body is the front portion and half body is the behind portion. Then that type of plane is called as frontal plane, and we can also say that's the anterior portion of the body and posterior portion of the body. So the plane that divides the body into anterior portion and posterior portion is called as frontal plane. It is perpendicular to the sagittal plane. The example of frontal plane in movement is jumping jacks. When we do jumping jacks, we move in frontal plane, and tilting held sideways is also the movement in frontal plane. Talking about example of sagittal plane, the examples are walking, running, and nodding head that place in a sagittal plane of the body. Next important plane is transverse plane. It is also called as axial plane or horizontal plane. It divides the body into superior portion and inferior portion. If we look at this diagram, we if we draw the plane like this, we dividing the body into superior portion and inferior portion. So this type of plane that divides the body into superior portion and inferior portion is basically the transverse plane. If we see in this diagram, if we divide the body here, this is the superior portion and this is the inferior portion. So this plane is called as transverse plane because it divides the body into superior and inferior portion. Examples of transverse plane include rotational movements. The next plane of anatomical plane is oblique plane. It is a plane that divides the body in angle other than 90 degree. So in start we said the imaginary plane surfaces are flat surfaces, but when they are not flat they are called as oblique plane. They divide the body in angle that is not 90 degree, because the 90-degree angle is for sagittal plane, frontal plane and transverse plane. But when the angle is not 90 degree, this is called as oblique plane. It is important for the structure that do not align with the major planes like sagittal plane, frontal plane and transverse plane. Importance of them is in the MRI, CT scan or any kind of imaging or radiography. Talking about clinical significance of anatomical plane, first their significance is in medical imaging. When we do medical imaging, we need a certain standard position or standard reference system to understand what is in that in medical imaging thing. So it is really important to understand anatomical plane for medical imaging. Second, they are important for surgical procedures too, so that it is important for surgical procedures so that we can better understand the structure and do the surgery according to the structure. So they are really important for anatomical planes are really important for surgical procedure. Next is physical therapy, as the doctors use different exercises for the patient in different planes so that the patient can easily understand. So these planes, anatomical planes, are really important for physical therapy. And the next thing is communication. If it is between the doctor and patient and or teacher and student, you need a proper plane so that you can properly convey your message, and the student or patient or other doctor can easily understand your message. You need a reference plane, and these are anatomical planes. So this was about clinical significance of anatomical plane. Hopefully you like the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.